Apex Benefits. Thanks so much for joining us this morning. Are you all able to see the screen okay?
I'm still downloading.
Okay.
The webinar is just a little slow this morning, my computer, so we'll see here just a second.
Okay, we'll give you just one more second.
Okay.
I would suggest, and well, we don't have very many participants, but ask everyone to put their phone on mute. Or we can put this phone and mute all of them. I can't remember how we set up the webinar. But when you have so few people, it's nice to have them be able to unmute themselves when they have a question. So that's whatever you'd like to do. Do you have a preference, Anita? Do you want everyone to be muted? Or do you want them to be able to interject with a question during your presentation time? You don't care either way. So I would just ask them to put their phones on mute, and if they have a question, you can unmute at a pause time. Sure.
Yeah, some of them are really slow.
I know, I wonder why Rick shows a little caution sign.
That means he's not viewing this as a screen screen.
He's one of those 22% that are in that. I think they can see. I think that's on audio, the audio piece or something.
Okay.
Because your screen is on show, so you should be good.
Should we hide this then?
I don't think we can see it, but
Okay.
you can if you want.
That's okay. If I click on this though, is it going to scroll through?
You can click the arrows down at the bottom right.
Okay. All right, let's go ahead and get started. Yep. Okay, we're going to go ahead and get started. If you wouldn't mind, please placing your phone on mute. But if you have a question, feel free to interject at a pause time. Like I said, my name is Cassie Lamb, and I'm from Apex Benefits. Today we do have a very special guest, Anita Gaylord from the Indiana Tobacco Prevention Council, here to help us learn about the resources that are available to employers for tobacco cessation as it pertains to their employees. Also joining us today is Vanessa Brown, Director of Communications and Wellness for Apex Benefits. As I stated, my name is Cassie Lamb, and I am the Health and Wellness Program Manager for Apex. Before we get started, I did want to give you a little bit of background about why wellness is important to me and why I feel tobacco cessation is a very important topic. Before I actively decided to make healthy lifestyle decisions, I was actually a smoker. I smoked for 4 years, mostly during college, when friends were smoking, and I also used it to keep me awake when I needed to study late. But quitting smoking was and still is one of the hardest things I've ever done in my life, but it's also one of the most fulfilling things I've ever done. I still struggle at times, just as anyone would, but as soon as I smell smoke, I can no longer crave a cigarette. I was fortunate enough to be able to quit without using nicotine replacement therapies or drugs, but part of the education process is learning from your mistakes and slip-ups. After deciding to change my lifestyle, I became a trained Freedom from Smoking facilitator for the American Lung Association, and I've been able to teach many classes through that program. Throughout those classes, I have been able to see that there's not one program that works for everyone, and unfortunately, it usually does take more than one quit attempt before you're successful. But all that said, I'm a testimony that with hard work and a little bit of a push, you can definitely make a decision that will change your life for the better. Once again, if we could ask everyone to just place your phone on mute, that would be perfect, just so we can have a clear sound. Without further ado, star 6 is going to be able to.
Star 6. Okay. Thank you. Sorry.
You're fine. Without further ado, I do want to introduce you to our guest speaker today, Anita Gaylord. She joined the staff of the Indiana Tobacco Prevention and Cessation Agency, now the Tobacco Prevention and Cessation Commission of the Indiana State Department of Health in July of 2001 as the Director of Community Programs. The community-based programs are implemented through local community-based partnerships, minority-based partnerships, and state and regional partnerships. Anita has been active in establishing the infrastructure for tobacco control in most counties in Indiana, and she's responsible for training, technical assistance, and most of the day-to-day activities of the TPC staff and coalitions in Indiana. So thanks so much, Anita. We're thrilled to have you here. And before I give it over to Anita, I did want to just go ahead and show everyone. As most of you know, Apex Benefits Healthy Connects offerings do connect healthy behaviors and choices. For today's webinar, we'll be focusing on the healthcare aspect of our Healthy Connects model as it relates to smoking cessation. So with that, let's begin our webinar. And Anita, I'll hand it over to you.
Okay, good morning, everyone. And by way of a quick bio on me, mine sounds a lot like Cassie's. I actually did smoke during college for about 4 years. When I was given the opportunity to think about why, I couldn't give you a good reason, except that everyone else was. But thankfully, I did quit. And upon quitting, I became a facilitator. And upon becoming a facilitator, I became active with the first national tobacco control program in the United States. It was called Assist. And that was back, I was at St. Francis Hospital, and that was back about 20 years ago. And from that, much of the country has tobacco control programs like we do in Indiana. So I am now at the Tobacco Prevention and Cessation Commission. So you see the objectives on the screen. These are the things that we're going to do our very, very best to talk about today. Primarily just a quick overview of the burden of tobacco, just to set the stage and to give context to the discussion. A little bit about tobacco use and the cost of tobacco use to the employee, to the employer, and to the state of Indiana. And then a lot of information about the quit line. So do feel free to stop me at any time, because I hope that our discussion about the quit line will generate some questions, and feel free to ask those questions as we're going through it. Just some information about nicotine replacement therapy and pharmacotherapy as it relates to the Indiana tobacco quit line. And then I'll conclude with some benefits of, we call cessation now tobacco use treatment. So cessation is tobacco use treatment, same thing. And then I'll finish the presentation with some information about tobacco-free cannabis policy and a little bit of information about the Tobacco Prevention and Cessation Commission, so that if you ever need us, you'll know exactly how to get in touch with us. And even though you've seen the presentation, you may already know the answer, but I like to start with just some facts. And this one's 25%. And what it represents is that it's the current adult smoking rate in the state of Indiana. We're actually going to get a new number today, because this is based on 2011 data, and we're going to get our 2012 today. But I don't know how that number sounds to you. 25% sounds like a high smoking rate to anyone, or 25% sounds like a low smoking rate. Let me tell you, it's a high smoking rate. Indiana is above the national average in every single one of these categories. All are above the national average, and I dare say when we get the new number today, we will still be above the national average. So we're above it in all adults, we're above it in men, and we're above it in women. And I don't know how to characterize it. I always say Indiana's in the top 10, or maybe Indiana's in the bottom 10, because as long as I've been doing tobacco control, we've been in at least single digits. We're now, with this number, 7th in the United States. That's 50 states and the District of Columbia. Utah is the lowest at 11.9%, and Kentucky is the highest at 29%. So Indiana does have a high smoking rate, which is why we're talking about this issue today, why we have a tobacco control program. Here's another big number. That's $2 billion. And believe it or not, that's the amount of medical costs related to smoking in the state of Indiana in 1 year. And the other big number is the cost of Medicaid expenditure. So we have a high smoking rate, but we also have a very high medical cost burden when you think about $2 billion, or even just not just, but the $487 million. So we in the state of Indiana spend a lot of money taking care of people who use tobacco products. Let me go to some national statistics real quick, more for your information. The one we quote all the time is smoking or tobacco use is the single most preventable cause of death and disease in the United States today, meaning it has an impact on practically every disease that the United States is confronted with, and especially the chronic diseases that we talk about all the time. And you see some of the other facts. It affects moms, it affects all kinds of cancers, of course it affects heart disease, and you probably already know that. But I wanted to put it in writing. This next slide shows another important statistic we use all the time, and that is tobacco kills more Americans each year than alcohol, cocaine, crack, heroin, homicides, suicide, car accidents, fire, and AIDS combined. It is a huge killer, and that's why we have to talk about it. And that's why it's important for employers to talk about it, because it does really have an impact on every aspect of our life, our health life and our productivity as well. And then we talk about secondhand smoke. We'll talk about that a little bit toward the end, but it's the third leading preventable cause of death and disease, and it has a huge impact on the lives of people in the United States as well. So let's get into this a little bit more and answer the question, and you may already know the answer to this question, but let's ask it anyway, and that is, why should employers care? What about this is so important to you? And I came up with three major reasons, and here's reason number one. An important discussion that you may be able to have with a tobacco user employee is the actual cost of tobacco use. Sometimes when we think about the cost of tobacco, all we think about is how much the retail cost is, how much does the product cost, which in fact is going up and up and up, and it's not cheap by any means. But there are all kinds of other costs associated with tobacco use, and that's what this slide is designed to show. It shows things that you may not even think about, or your employee may not even think about, other than the product itself. And these costs are rarely examined, and it really does impact how much money a person is spending on tobacco use. So this slide gives you other things to talk about with your employees when it comes to the cost of tobacco use. So reason number one that you should care, of course, is that your employee is your most important asset. And the fact that they're using tobacco means that they're spending a lot of money, not just on the product, but in other ways. And, it goes without saying that the employee's health is one of the number one reasons that it helps you to understand tobacco use behavior and the resources available. When you have a healthy employee, that's physically healthy employee, then your employee is more productive, your employee is happier, and it just has a huge impact on the bottom line of the business. But I'm not going to read those to you, just giving you an idea of the costs associated with tobacco use. I did, how we just Google, I just did a little bit of research as I was preparing for this presentation to see what I could find on the cost of a smoking employee. And this was a recent report. It's dated June 3rd, 2013. And the estimate is at $6,000 more per year. So obviously as an employer, you're concerned, because that's $6,000 more per year for any employee who's using tobacco products. Then it becomes your business, I think, to at least know the resources that are available to help anyone who's using tobacco to stop using tobacco. When you look at the Tobacco Prevention and Cessation Commission's toolkit, which I believe was sent to you, our estimate is at about $3,300. So who knows? We know that the costs are higher, but now that we're speculating costs as high as $6,000. The bottom line, this behavior costs an employer a lot, it costs the employee a lot, and the cost will just continue to increase. And across the country, although we're talking about Indiana today, there are resources to help anyone who's using tobacco to quit. Reason number two, and we talked about it already, of course, the health of your employee is a major factor in your bottom line. You care about your employees, you care about their health, you care about their productivity. And I don't like to burden you with too many statistics, but listen to this. Tobacco users visit healthcare professionals up to 6 times more often than non-users, are admitted to the hospital almost twice as often as non-users, on average almost 3 times as much sick leave as non-users, and significantly more sick leave than former users, and had about 2 times more lost production time per worker than workers who never used. which was estimated for the United States at a cost of about $27 billion. So we know that the employee has all of the things listed on the slide, but the employer is significantly impacted in a productivity way and a health cost way when the employees are using tobacco products. So that's reason number 2. The health of your employees is a major factor, and there's something you can do. Here's a poll, and we'd like for you to just quickly answer this question. Does your employee benefit plan cover tobacco use cessation? And by tobacco use cessation, this is nicotine replacement therapy, or pharmacotherapy, or cessation classes. Yes, no, or I don't know. The poll is open. Okay, so for those of you on the call, it's what, 60% no, 20% yes, and 20% I don't know. So I hope this presentation will help come up with some very concrete, specific reasons why your company may want to consider keeping benefits or putting benefits in the employee packet on tobacco use cessation. That's exactly what we're trying to do, is convince you to consider tobacco cessation benefits. Reason number 3, and this goes straight to the benefits. Offering tobacco use cessation benefits is the number 1 cost-effective benefit employers can provide. This doesn't discount the other benefits that are provided, but we're spending a lot of time, we, the Tobacco Prevention and Cessation Commission, are spending a lot of time talking to employers to raise the level of awareness on how much it helps your employees' health and your bottom line when you offer tobacco use cessation benefits. The other thing it does is it gives you an opportunity to hear and learn more information about the Indiana Tobacco Quit Line, which is a free resource available to you, an employer, as a cessation benefit. So the employer plays a significant role in encouraging employees to quit using tobacco products. I'm going to go ahead and tell you this now, and I think it will make more sense later. But when someone uses the quit line, the first call, the person decides if they're going to enroll or not. And here's what we know. When the healthcare provider fax refers or refers someone to the Indiana Tobacco Quit Line, there's a certain percentage, about half, who actually enroll. When the employer fax refers or encourages someone to use the Indiana Tobacco Quit Line, the percentage of those who enroll is even higher, more like 75%. My point is this: it seems like, and I believe it for obvious reasons, that when employers have serious conversations with their employees about not using tobacco products, it does help and it does move the employee to enroll in the Indiana Tobacco Quit Line, which is a very, very good first step to making that quit attempt. So you, as the employer, play a very, very important role in offering cessation benefits, in knowing what benefits and resources are available, and in having conversations, good, sensitive conversations with your employees about not using tobacco products. Okay. I don't know if anyone has any questions, because our next few slides are specific information on the Indiana Tobacco Quit Line. Let me pause for a moment to see if you have any questions. Okay, let's go ahead and get into the Indiana Tobacco Quit Line. The next slide shows some of the characteristics of a quit line. It is telephone-based cessation services. It's offered on a toll-free number. It's been studied, it's evidence-based, we know that it works, and it works for all types of people, all kinds of people, all ethnicities. It's shown to be very effective, and we'll talk a little bit more about its benefits in just a minute. It's proactive, meaning that there are different ways to get in contact with the Indiana Tobacco Quit Line, and oftentimes we can make it so the quit line calls your employee. So we take the onus, the responsibility of getting in touch with anyone who wants to stop using tobacco products. It has highly trained coaches. They're this is what they do. This is all they do. So we spend a lot of time in talking to employers and healthcare providers about the quit line, making sure you understand that when your employee, when your patient calls the Indiana Tobacco Quit Line, they are going to be in contact with a very well-trained, well-educated, very competent coach who's going to talk them through, walk them through, help them quit using tobacco products. So you see some of the characteristics of the coach. So let me get into a little bit of our the quit line treatment approach. It has 4 what we call key essential practices. And those are the quit coach, the web coach, medication, and the quit guide. And all of these components are included in these services. So the first 3 bullets give you an idea specifically of the program components. 4 prearranged calls with the coach for those 18 years and above. If she lets us know that she's pregnant, she then gets 10 prearranged calls, and 10 calls because we want to do some calls after the baby is born. And we have added, and I'll give you a little more information on this a little later, for youth, young adults, young teenagers, 13 to 17 years old, they get 5 prearranged calls. And then you see the 4 essential practices. That's the next 4 bullets, the essential practices. A quit coach, a person who is trained to help citizens stop using tobacco. And there's unlimited privileges to the quit coach, meaning they can call in, or the quit coach will call them on their prearranged call. But if they get caught in a bind, or they're in a situation where their cravings are out of control, then they still have access to the web coach, which is web-based, or the quit coach, which is phone-based. And right now, the medication part of the essential practice is that we are offering free 2-week nicotine replacement therapy starter kits. Right now, though, it goes to the uninsured, Medicaid, and Medicare, and I'm not sure if that applies to any of your employees. There was a time when we offered it to everyone. It is a resource decision, but right now there's free nicotine replacement therapy for those who let us know that they're uninsured, Medicaid, and Medicare. And in every single case, whether we call the employee or the employee calls the quit line, we will send some support materials to the person who makes the call. It's really good. I should say stage-based support materials. Very good materials written at a very good educational level that starts to give people information about quitting, about first steps to take, whether they decide to sign on and enroll or not. So that gives you an idea of some of the key components of the Indiana Tobacco Quit Line. Here are the benefits. It's confidential, meaning the information is not shared. The call is between the coach and the employee, and it's done at the time that is pre-established and hopefully convenient for the employee. It's free. The state of Indiana pays for it, but it's free to Hoosiers and citizens in Indiana. It does have a national call number, 1-800-QUIT-NOW, and that's practically everywhere in the country, but easy to remember, I hope. The HIPAA compliant entity doesn't apply to employers so much as it does healthcare providers, but if an entity is HIPAA compliant, that has to do with confidentiality, then the Indiana Tobacco Quit Line will send the results back to the HIPAA compliant entity. Most employers are not HIPAA compliant, so the employer will not get any information back, but the employer, as I've already said, still plays a very, very important role. The quit line is easy to use by employers and by participants, and oftentimes, and we'll get into this in just a minute, the tobacco user doesn't even have to make the initial call. The initial call is made to the tobacco user by the quit coach. Just I'm not going to read these to you, but I want you to understand that it is telephone counseling. It's intensive, it's intentional, it's done by trained people, as I've already said, so that the individuals get a lot of information, and it's a lot like the cessation classes that you may be used to. I mean, quitting techniques and trigger mechanisms and conversations about all of that are about the same. This is done free in the comfort of their own home or wherever they want to make the call, but they get a lot of information in this one-on-one counseling. It's okay. And then there's unlimited access, and this is an important slide because quitting smoking is not easy, and it doesn't happen during the hours of 8 to 5, so that there's access to the phone counseling, there's access to the web coach. We're going to talk in just a moment about text to quit. We know that there are other elements of tobacco control that help at the employer location, like the fourth bullet, which is to implement a smoke-free policy, to make sure you include family and friends, and of course, family and friends of the employee are eligible to call a quit line, and then some of the other things that we do with tobacco control to complement current programs. So this just gives you an idea of how the Indiana Tobacco Quit Line can fit into everyone's everyday life and is consistently there to help with the counseling. This next slide is busy, and the only reason that I included this is to give you an idea of what happens. Now, I usually say call the quit line as the employer who may want to use the resource and refer someone to it so you understand what happens. But this just gives you an idea of what really does happen, a picture of the process. What happens is that your employee would talk to an intake specialist. That first call takes a little bit of extra time because it's demographics and health history and some other things, and then they talk to the professional coach. So just to give you an idea of what the experience is like. But it's a telephone call, counseling call. First call is kind of long because we're getting a lot of information. That's when they're invited to enroll. And then once they enroll, they talk to the professional coach and they pre-schedule their sessions. But they have access to the coach or the website at any time. So that just is kind of a pictorial rendition of the participant experience. Okay? Okay, this is kind of concluding, finishing up with the Indiana Tobacco Quit Line. Each plan is different, it's customized, it's decided upon based upon a conversation with the person who uses tobacco. They are encouraged to contact their physician. The medications, other than the over-the-counter nicotine replacement therapy, starter kits, if they qualify, are distributed through the quit line, but any other medications have to be given through their physician. And even if a person is not ready to quit, the staff will talk to them about how they prepare themselves for a successful quit. So we don't consider it a failure if we have a conversation with someone and they decide not to enroll. And the reason is it's called thinking about quitting, or what we call quit attempts. And we know that thinking about quitting is moving someone along the continuum to quit for good. And we know that a quit attempt, even if they don't quit for good, is moving them even further along the continuum to make it quit. And that's what we want to do, get them closer and closer to quitting. Just some more stats. We've had more than 100,000 Hoosiers use the quit line since we launched it in 2006. So we know that it is a good resource for your employees. So here's what we'd like for the employers to do. Introduce your employees to the Indiana Tobacco Quit Line. There's free informational materials. I'll show you how to get it. As I said, it doesn't cost anything. So have some information about the quit line available. I don't know where, all over any place you can put it so that people can pick it up, you can have a conversation about it, and you can talk to them about using the Indiana Tobacco Quit Line. As an employer, you are able to fax refer, and I'll show you the form in just a moment, and you did get that as an attachment. You can fax refer your employees to the quit line, and then the quit line will call the employee in 24 to 48 hours. Now, this is with permission from your employee to fax refer. And then the employee, upon request, can get a certificate when they complete the quit calls and present that to you, the employer, to prove that they did it if that's what you would like to require. You will not get any information from the Indiana Tobacco Quit Line because of the HIPAA compliance laws. Okay? This is the form. One of them says employer, and that's the one you received. It's a fax referral form. It does require a signature of your employee, and it's still old-fashioned right now. You fax refer to the Indiana Tobacco Quit Line, and you have, as an employer, done all you have to do to put that employee in contact with the quit line. At that point, we take it from there. We will call. We'll do about 4 or 5 outbound calls to your employee and try to get them, talk to them about the Indiana Tobacco Quit Line and get them to enroll, or at least get information to them about quitting. So that's what we really are talking about today, understanding and knowing information, having resources available about the Indiana Tobacco Quit Line, and introducing your employees to it, and then letting us take it from there. This is the Quit Line number. You can help build their interest by giving them this information, by having materials available, by referring them to the Indiana Tobacco Quit Line. And one other thing we can do is we have what we call the Preferred Employer Network. And this is the form, and you did receive that as an attachment to the announcement about this webinar, because what we do is we simply put you as an employer, put your name in a database so that we can stay in contact with you on changes to the Indiana Tobacco Quit Line. It's not where you're going to get emailed every day about cessation or quitting. For instance, if there comes a time when the Indiana Tobacco Quit Line provides nicotine replacement therapy to everyone like we used to do, then we would do an e-blast to the Preferred Employer Network and let you know now nicotine replacement therapy is available to everyone. So if you would like to, go ahead and fill out that form and fax it in. We'll include your name and information in our Preferred Employer database so you can get up-to-date information on the Indiana Tobacco Quit Line. Let me spend just a few minutes because there are what we call new services. They were new in January, and before all we had was the intensive one-on-one telephone coaching. Now we've added 3 new services. Web Coach is a private website. So if someone doesn't like the telephone or doesn't want to use the telephone and they would like to get their cessation information and their coaching web-based, they now can enroll on Web Coach. And it's the same information, only it's of course delivered through the internet and through a website versus a coach. So Web Coach is available. It's designed to support and assist tobacco users throughout their entire quitting process. They set a quit plan and learn about strategies to quit for life. It just depends on someone's learning preference. Do they want to talk to somebody or do they want to do it web-based? So that's available, Web Coach services. We did just add a text-to-quit service. Probably no surprise that there are over 270 million mobile phones, and most of us who own a phone receive and send text messages. So the opportunity to enroll in a text-to-quit service makes sense when it comes to quitting. The next slide shows, I think I put it in there. But it's the typical quit texts. When the quit line knows what your quit date is, then the slide will start, you'll get a text the day you're going to quit and say, hey, today's your quit day, congratulations. Did you quit, yes or no? Do you want some additional information or advice? And just texting to keep up with the quit process. That's text to quit service. I will say this, the young people, 13 to 17, are not eligible for the text to quit. And then the other one was the youth program that we added. Just know that the youth services get 5 calls, and the quit coaches who conduct the youth services use specific techniques that make sense to young people. The things that matter to them when it comes to quitting smoking or hopefully not using tobacco are different from adults. So it's a specific group of coaches who spend specific time on the 13 to 17-year-olds. This slide just gives you an idea of the quit line effectiveness. It shows the studies that have been done. This is the reason the United States, the state of Indiana, has made a significant investment in the quit line. We know that it eliminates barriers. It's helpful for unlimited mobility, certainly good for rural and remote areas, and it seems to appeal to a lot of different people. So that slide just gives you an idea of its effectiveness. And then the next slide just kind of summarizes why the program works. It's a personal pace. It's the same kind of information about managing triggers and urges to smoke as you would in a face-to-face class. It does include pharmacotherapy when appropriate and prescribed by the doctor. And our goal, of course, is to not just have them quit, but to have them become a non-smoker for life. and we know that this program works. Just to give you an idea, this is calls to the quit line through June. The spikes you see in March and April are almost always, when we have spikes like that, are due to a media campaign. When we are able to promote the Indiana Tobacco Quit Line in a statewide media campaign, we do, and the number of calls to the Indiana Tobacco Quit Line obviously increased during that time. But we have limited media dollars, we have a limited media budget, which is why we're counting on employers and healthcare providers to promote the Indiana Tobacco Quit Line and refer to the Indiana Tobacco Quit Line at all times. This is a screenshot of IndianaQuitLine.net, and this is where you can get your free materials. There's all kinds of information on this website. There's information for the tobacco user, there's information for the provider, there's information for the employer, there's information for family and friends. But on the left side, you can see where it says employers, so you can get some more information about the cost, the cessation benefits, anything you want to know about going smoke-free at your employer location and then becoming a preferred employer. Right above that, under healthcare providers, it says order materials. That's where you can go online and order any of the free materials that the Indiana Tobacco Prevention and Cessation Commission has on the Indiana Quit Line. So this is a website that you can get to very easily and order materials. So let me conclude the discussion just as reminders. We are talking about tobacco use and treatment of tobacco use the same way we like to talk about other chronic diseases, and that's really becoming the discussion that public health is having right now. That it gets the same attention as other chronic diseases, and that's something we're trying to convince employers to do, is to help help treat tobacco use with your employees, just like you help with some of the other chronic diseases, because we know it's costing a lot of money. The fax referral system is a process that's available to you, the employer, and it's the cornerstone of diverse cessation success. What we mean by that is that when you have the conversation, because you understand the resources that are available and you understand how much tobacco use is costing you, and you fax refer across the board to anyone who uses any kind of tobacco products, and I should probably say the Indiana Tobacco Quit Line also talks about spit tobacco, cigars, and other tobacco products. So we're talking about tobacco use treatment. Then you really can start to move people toward that quit attempt. And you can fax refer so that the quit line does the work after that. What we're trying to do today is give you knowledge of the support and the resources that are available, and give you knowledge about why it's important to provide treatment in your benefit package. And then you can get additional information by enrolling as a preferred employer. Here are some resources, lots of different websites, there's lots of information available to you to get more information about tobacco use. It's all out there, it's available to you, so you can get more information. So I'm going to switch gears for just a couple of minutes, I know we're running out of time, and let me ask another question, and that is, does your workplace have a written policy that prohibits tobacco use on the property, that's on the grounds on the campus? I know you can't use them inside the building now because of the state law, but what about the campus policy? The poll is open. Okay, so we have some work to do. It shows that at least those on the call do not have a policy on the property. And this is important because when you promote, even inside an indoor tobacco-free policy, an environment, or you have lots of tobacco users who are quitting, not being able to use tobacco on the property also sends a message, and it helps with the quitting process. What we always say at TPC is that a policy is a cessation strategy, meaning when we have good policies in place that prohibit tobacco use everywhere, then it does help someone who uses tobacco to make a quick decision. It kind of goes like this: well, shoot, I can't smoke inside the building, I can't smoke outside the building, I can't smoke, in my car. I can't smoke when I go to the mall. I can't smoke in all these different places. I guess I just need to quit. And it really does work. So there's a lot of information about going to a campus-free policy. You were sent some of that information. That information is also on our website. So I would encourage you, because of the state law and because of your interest in providing tobacco use treatment benefits, to also consider a written policy that prohibits tobacco use on property.
At Apex Benefits, we also have a model tobacco-free policy, so if you have any questions or would just like to see an example of that, feel free to shoot me an email and I can send you a copy of the ones that we're able to provide for you.
And I did want to provide, just to give you an idea that, because I know Apex has businesses all over the state, this is a map of the Tobacco Prevention and Cessation Commission, what we call funded counties. We have coalitions that are working on tobacco control issues in the counties that you see in green, red, and blue. So I'm not sure where you are or if you're across the state, but I wanted you to know that there's a lot of help out there. So if you have different locations in different counties of the state of Indiana, there are people actually out there working on tobacco control who can provide assistance to you. And the next, that is a screenshot of our website, which gives you that information. If you go to the community programs and then click on the first drop-down menu, you'll get a map of Indiana. You can click on the county and get specific information about tobacco control going on across the state of Indiana. And that's just some information I wanted to throw in so you would know that all kinds of things are going on with tobacco control across the state.
So as many of you know, on May 29, 2013, the Department of Labor, Health and Human Services and the Treasury released final regulations that implement the healthcare reform non-discrimination requirements for wellness programs. The final regulations do clarify and reorganize the rules outlined in previous proposed regulations. So these final regulations increase the permissible reward for meeting a health-related standard to 30% of the total cost of employee-only coverage, or 50% if the program is designed to prevent or reduce tobacco use. So here at Apex, we are your partner for healthcare reform. So please keep in mind we're here to help and make sure your program is compliant. And as the Health and Wellness Program Manager, I'm here to be your partner in designing those model tobacco-free policies and implementing those so that we can be compliant with the 50% differential if that's a route that you choose to go. As far as best practices go, we do want to recommend that you provide a supportive environment for those who are quitting. And obviously you want to promote your tobacco cessation program. For many people, it's simply requiring people to complete the tobacco cessation program, such as the 1-800-QUIT-NOW. And like Anita mentioned, employees can bring in a certificate that they have completed that program. So if this is going to be your reasonable alternative standard for having a tobacco user premium differential, there are ways to verify that, so please keep that in mind. And then you also want to structure your premium differentials to reward your activities. We have found many of our clients have found by positioning a premium differential as an opportunity for a reward rather than a penalty or a surcharge, that increases compliance as well. So like Anita said, we want to implement those tobacco-free policies so that it becomes a lifestyle change for your employees. Please keep in mind we are your partner in this tobacco-free cessation, and we do want to let you know we have plenty of resources, including Anita, that are available at your fingertips. So please utilize those as you see fit. So finally, does anyone have any questions? Feel free to submit them via the questions bar, or just go ahead and ask those questions for Anita or myself, and we're happy to answer. Thanks so much for joining us today. If you're going to pop off, so feel free to ask those questions. Anita, do we have the 1-800-QUIT line? Is that throughout multiple states? So if we have an employer who has multiple locations, are they able to access that QUIT line throughout different states?
Yes, all of the states, all 50 states and the District of Columbia have a QUIT line. Now, most of the states use 1-800-QUIT-NOW, but it's not 100% of the states, so you may have to check to find out what the number is. Or You can try 1-800-QUIT now, but yes, a quit line, a tobacco cessation, tobacco use treatment quit line is available to anyone across the United States. The other thing I will say to that though, is that each quit line is managed by the state, so the benefits that are offered as a result of the quit line do vary from state to state. Like Indiana offers the nicotine replacement therapy to only uninsured Medicare and Medicaid. Michigan may offer it to everyone. So it varies from state to state, but the availability of telephone counseling is there for everyone.
Awesome. Well, I don't see any other questions coming through, so feel free if you have a follow-up question to send me an email and we will get those to Anita. So thanks so much for participating in our webinar today, and I'd like to thank Anita for participating as well, for all of her expertise. And I